So, we have a wife coming in with her husband. Sadly, the husband ended up dizzy, ended up lightheaded, and he ended up falling down. Terrible fall. But where he fell, it was on a chair. So the wife's question to us was, should I leave him in the chair or should I carefully put him on the floor if he's still able to place himself on the floor and just stay flat on the ground? So what we always do recommend, if you're able to, get that patient lateral, in a lateral position, meaning make sure that patient becomes flat. Why is that? Well, that's going to actually promote circulation. It actually helps prevent deep vein thrombosis, pulmonary emboli. And a lot of pushback is, well, if they're flat on their back and they're facing upward, what happens if they vomit? What happens if there's an airway obstruction? Well, what we do is we put them in what we call the log roll or recovery position. Generally, if you happen to be able to be there and move them to the side, there is any vomit, any fluid coming up, it'll eventually go to the side and you're going to be able to make sure that airway stays open. If the patient is pregnant or suspected to be pregnant at any point, you want to make sure you put that patient in the recovery position, but mainly on her left recumbrance. So what happens is we're going to make sure that the fetus is not exerting any pain on what we call, or pressure on what we call the inferior vena cava. And what that does is that prevents the parent or the mom from dying from hypovolemia. So please feel free to share. Remember, lateral position is best. And yes, you want to put that person in the recovery position carefully. We do have other videos explaining how to properly place a patient in the recovery position. Share and like. Have an awesome day.
Dad joke incoming. You are welcome.
Also, please keep in mind, if that family member fell on a chair, we will deem that family member the official chair holder for that event.